dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and today we're going to be talking about mosquitoes, West Nile virus, and EEE. And I am fortunate to have as my guest today Heidi Peek-Kukulka, who is from the City of Nashua Division of Public Health and Community Services in the Environmental Health Department. Welcome.
Thank you very much, Yvonne.
I'm so pleased that you're here. And it's a very important conversation because people are home and about and outside enjoying the beautiful weather as well as they travel. So this is an important piece to do. So what is West Nile virus?
West Nile virus is a virus that came from around literally the West Nile and wasn't seen here in this area until 1999 when we had our first outbreak in New York City. And it had been a very dry year that year, so everyone was collecting rainwater in buckets. And that I will be talking about that a little bit more because it's an important part of
prevention.
This mosquito. And there was a very sharp physician who picked up that a few of the patients in the hospital had the same symptoms. But 1999 for an emerging disease as significant as West Nile virus is fascinating.
So, mosquitoes is what carries West Nile virus?
Yes, and other diseases as well.
So what are the symptoms of West Nile virus?
Well, you're going to see the symptoms are the same for a lot of these diseases where it's general flu-like symptoms. Some of these, though, will also end up with a fever, and some with the worst thing that happens would be meningitis or encephalitis. So that stiff neck, those, and a fever that doesn't go away are the things that should drive a person to go seek medical attention.
So specific symptoms, stiff neck and fever?
Yes, a fever that won't go away.
And is this right after one has been bitten?
No, it's usually, the different diseases have different times of transmission, but it's usually within a 24-hour to a 1-week period of time.
Okay. And what other diseases would mosquito bites cause?
What we call triple E, Eastern equine encephalitis. That is a more serious disease than West Nile virus. We've also seen the first case of Jamestown Canyon virus in New Hampshire, and also the first couple of cases in Maine as well. And it's a milder disease than Eastern equine encephalitis, but it's the first time it's happened here. And we're also concerned with shifting weather patterns and climate change with the potential for malaria outbreaks. There hasn't been one in this area for a very long time, but historically there was one in Massachusetts. Travelers need to be concerned about dengue, chikungunya, and Zika virus.
And how does that relate to the mosquito?
It's all about the prevention and being aware and taking safe precautions when we are around mosquito populations. And very often when we travel, we don't take into consideration that it's an entire different ecosystem. And people who are in different tropical areas may have developed some immunity to some of the diseases, but as travelers, we're going to be impacted more greatly than they are.
So what do we need to do for prevention?
Well, for the different things, we look at things differently, whether they are here or whether or not, where the mosquito populations are is what I'm trying to say. So there are separate things that we can do specifically for mosquitoes that are in our area.
Meaning New England.
New England.
Okay.
And then when we travel to tropical climates, we need to be aware of mosquitoes and use repellents just as we've tried to get people to do in this area. And especially be very mindful of activities that are from dusk to dawn, when mosquitoes are going to be more likely to be out and be biting.
Go ahead.
That's important for, say, soccer practice. When it gets, our days are getting, our light is getting less earlier, and we need to be mindful that the mosquitoes are coming out earlier, and if we're putting kids onto soccer practice fields and it's getting dark out, we need to be taking proper precautions with some sort of a repellent.
Okay, now from early morning, that's also a time where we should be having prevention.
Yes, unless it's below 50 degrees. Mosquitoes will not fly in a degree lower than 50 degrees.
So south of us, in our southern states, is that also a problem? Because people travel from New England to the south.
Yes, what you'll find often in most parts of, say, more touristy areas, they have very comprehensive mosquito spraying programs that most of us as tourists aren't aware of. And they are to do two things: to take care of the public health hazard and also to take care of nuisance mosquitoes. Most coastal areas do spray for mosquitoes, and we just are not aware of it on a large scale. And certainly, from having lived in the South, I know that they also, most neighborhoods are sprayed because you just couldn't be outside.
Really?
The mosquitoes are so thick.
But even though there is spraying that is occurring, that shouldn't stop us from the prevention as far as what to do.
Correct, especially when we're going to places where they don't have some sort of a program like that.
And how would we know that?
Look into what, take a look on Google at what some of the prevalent diseases are for specific areas and be mindful of it, and be prepared and take some sort of a repellent with you just in case. Because if you know that you're being bitten by mosquitoes, that's a problem.
And what are the types of repellents that people should take? Let's start with what would be good for children, because that's an important component, and the difference of what adults could have. Or maybe it's the same.
Well, EPA has done a really good job in coming up with specific registry of pesticides.
So that would be the Environmental Protection Agency.org.
Correct. And they will actually, they're getting better about their labeling on pesticides. These are very tightly regulated products. And we want something that is effective for a specific insect. And some of the labeling is now reflective of that. It shows, I'm not especially a fan of saying that a specific insecticide will prevent West Nile virus. I want to know more that it's going to prevent mosquito bites. But there's a new logo that they've come up with, and I tried to find an example at the local store, and it's something that is evolving. But it will say how often something needs to be reapplied and what age group and what insect something is good for, because there are ticks and mosquitoes that these repellents are effective at. And what we don't want to see is we want to see that people are using whatever product it is according to what's stated on the label. And if it's something that's going to be applied to a child or an elderly person, it should be applied to hands first and then put onto children. You should never spray an insecticide or a repellent directly onto a human being. It should be put onto hands and then applied to skin.
Wow, and there's so
or
many
clothing.
sprays out there, and people automatically just spray it.
Right.
So you never do that. Why?
These are powerful chemicals, and they're useful tools, but we need to be mindful that they do have a toxicity level, and we need to be respectful of that. Like the deep woods off, the very high levels of DEET,
Yes.
those have a use, but they would be more for your hunters, your fishermen, people who are in literally deep woods, where a child should have a lower concentration of DEET. And I'm not going to go into the specific numbers because it's right there on the packaging and on the EPA website.
Now, are there more natural components that could be used, like eucalyptus and lemon?
Yes, yes, there are some other things. EPA has also listed those as well. And the alternatives, there are some things that just don't work. I know everybody, people swear by Skin So Soft, but it has been proven through some trials that it really doesn't do much.
Really?
But there are alternatives that are not DEET-based, but DEET is the primary ingredient in most of those over-the-counter.
You mentioned about the importance of not spraying it and put it into your hand first and then apply it. In the application, it's just rubbing it in that you're saying? Just
yes.
All parts of the exposed skin? Exposed
skin, and there is another compound called pyrethrin, and hunters can get clothing that has this, it's already, the clothing is impregnated with pyrethrins. It's how they make tents for malaria for Africa. They use the same compound.
Really?
Because it works effectively in clothing.
So when we put it on our hands, though, I would think it'd be really important because that you wash your hands after you do that. Because if those hands go in the mouth or the eyes or anything
Absolutely.
else, that could be very dangerous.
Right, and so we don't want children to have it on their hands because they're always hands
in
to
the mouth. Right.
And we don't want it right near their mouths or their noses or their eyes.
So application on the face, best way to do it.
Very gently and very lightly.
And it would be not near the eyes, so it would be the cheeks, the chin, the neck, the forehead, probably the head too, right?
Yes. Yes.
Okay. So what are other important bits of information that you want to make sure people know related to the West Nile virus and EEE?
I can't seem to get this to work. Most recently, one of the things that has happened is that we got our first positive batch of mosquitoes positive for West Nile virus within the city of Nashua.
Now, how do you find that?
We have a contractor who does mosquito surveillance for us on a weekly basis, and there have been 2 positive batches in Manchester, 1 in Keene, and most recently in Nashua. The state has, what I'm showing right now is a risk map. We are still, and this shows some historical information, we are at a low risk level. This new finding does not change that risk. If we had extended batches, they might change us to moderate. But we need to be mindful that the season is here. The surveillance has done its job. We've determined that there is a very small quantity of positive mosquitoes in Nashua. And so some of those natural prevention things that we should be talking about, more physical, we should be taking care of as well.
Explain that further.
Certainly, and I'm going to go right to find that slide. Well, here we talk a little bit about using repellent safely, and so that is certainly one of the first things. We need to be especially mindful if there is not a breeze, if it's above 50 degrees outside. We want people to go outside and enjoy nature, but we also want them to be protected. And we also, especially when it starts to get dark, mosquitoes tend to be more likely to bite.
And it's important when people put on insect repellents that they don't do it inside. They should always do it outside, right?
Yes. Yeah, because again, they're powerful, toxic pesticides, but those are the formulations that are safe, but you don't want to be breathing that unnecessarily.
And you don't want that in the house.
No, you don't.
No.
So around people's properties, they should remove any type of standing water. The Culex pipiens is the mosquito that was tested most recently that was positive for West Nile virus. They are container breeders, and some of what I was talking about, what happened in New York City for that first year, was people were storing water in small containers, and they were having these mosquitoes that had just found their way to this country breeding in those small containers of water. Really? So we want to be mindful of tires in a yard, abandoned swimming pools, buckets of water, trash containers.
What about those fountains that people have?
Those,
if they're turned off, if they continue running, it's fine, but if they're turned off?
Correct, exactly.
Is there anything you can put into the water?
You can actually put in, it might not work in a fountain, but chemically treated water, like for a pool, not allow mosquitoes to breed in it. Soap is also a surfactant, and it breaks down the water tension, so the mosquitoes cannot land and lay their eggs. They drown.
Interesting. So let's say, a lot of people have these water fountains, for the atmosphere, right? I wonder if you put in the some of the essential oils, like eucalyptus and lemon, into the water. Would that make them avoid going there if the water was still? Or what would you need to do in between you're having it on or not?
I would say be more mindful about changing out the water. A lot of times those little filtration units might get gunked up and clogged, and that might not work.
So when you say buckets of water, tires of water, puddles of water, there's puddles when it rains, more likely during rain that mosquitoes come out?
Actually, last year we had a very dry year, and so we didn't see a lot of activity. We did have the one and only positive West Nile virus pool in Nashua, but this year we're seeing all the rain that we're having, and it just, every strong rainstorm that causes puddling to occur in areas and the lakes to rise a little bit creates more mosquitoes.
So you want them to remove old tires, dispose of tin cans, plastic containers, and ceramic pots and other containers, drill holes in the bottom of recycling bins that are left outside, make sure roofs and gutters are clean and drained properly.
Yep, and bird baths should be dumped out every 3 days or so.
That's important.
And it doesn't have to be treated water, it just needs to be fresh water.
So fresh water is the key? They're not attracted to fresh water, just old water?
Well, they're attracted to any type of water, but you're not going to have mosquitoes laying eggs, the eggs hatching in that space of time. So that's more important.
What other prevention items?
We go to the next slide. Keeping grass cut is good for mosquitoes and for ticks. We want to take just a critical look at our living environment, whether we rent or we own, and taking a look to make sure that we have window screens if the windows are going to be open. We don't want our doors to remain closed to remain open unless we have a screen door as well.
Important to check the screens also to make sure there aren't any holes in the screens. What about checking animals that are going from outside to inside? Can they bring in mosquitoes with them?
They're more likely to bring ticks in, but they certainly can bring in mosquitoes, and it's going to be more when the door is open to let the animal in and out.
Right.
And
they'll come right in.
Yeah, and that's where you'd want to be mindful of, like, the pet doors.
Yes.
I don't like those because raccoons can get in.
Oh.
But those doors are barrier methods for a reason.
All right. What other things? Are bug light bulbs too?
Those tend to attract more than they deter.
Okay, that's important.
Yeah, so this is a graphic that just shows all of those things that we talked about. Anything where standing water can collect, we need to be mindful of and just dump things over. Like you said, drill holes into the bottom of recycling bins. Make sure that the pool cover, if the pool is covered, that you're not storing water on there as well. Dumping out the wading pool, or in my yard we have a dog pool. And dumping that and replenishing water like every 3 days or so is probably the best bet.
So there we've covered protecting the home. We've covered about things that we can put on us related to sprays, but not to spray it. Put it in the hand and then apply it. Apply it to just the skin or also the clothes.
You can put the spray on the clothing.
But don't spray it. Pat it and then put it in and wash your hands.
Especially with children and the elderly, or anyone who is whose immune system is sensitive.
So is it important that we really be mindful as to what we wear before we go out to keep our bodies more covered? Are they more inclined to protect us?
Absolutely. Pretty much like with Lyme disease, having long sleeves and long pants. The problem with mosquitoes, though, is if you're wearing something that's tight-fitting, they can bite right through it. So you want to have a loose outer layer if you can, and if you're going to be outside, you want to be mindful of ticks as well. So light-colored clothing is always recommended. But but long pants to cover pants, legs,
Socks to cover the
and socks
feet.
to cover your feet as well. But again, if it's below 50 degrees, and I forgot what the temperature was first thing this morning. It was very cool. It was comfortable. People want to get out and enjoy the weather early, and it's 50 degrees. You really don't need to be very mindful of mosquitoes. If it's breezy, you really don't need to be that mindful of mosquitoes either.
What about people playing sports or outdoor activities? What did they, like the children, they're going to be going back to school, they're in school and they're active in the sports a variety of times. What do they need to do?
Well, that's where parents need to be mindful of what happens after, when it starts to get dark, mosquitoes start to come out. They're attracted to us by our temperature and our respiration. They're attracted to the CO2 that we exhale. So they're going to be able to find us, and at night they're going to be more of them out because they dry out quickly in sunlight. So parents need to make sure that they have some sort of a bug spray for their kids that they can put in their bags if they're old enough, or be reapplying as it gets darker if they're with them.
So when you said they're more attracted to us when the CO2 comes out of us. So are you
Yes.
saying every time we breathe and exhale,
Yes,
they're attracted to that?
yes, they are.
So does that mean when we're outside we shouldn't talk as much?
No, that isn't. But the light traps that we use for trapping,
Yes.
we use dry ice to generate carbon dioxide to mimic respiration.
Really?
So it's a light. They're attracted to that light and then the carbon dioxide.
And that's how you determine if, in fact, the West Nile is coming,
Yes.
if there are mosquitoes infected.
There-
Isn't that interesting?
Yeah, there are a few variation of different traps, but the light trap is one. The gravid trap, where it's just smelly water, is another one, and that encourages mosquitoes to breed in that water. And right now, throughout the state, there are some traps to try and see whether or not we have the mosquito, the Aedes aegypti, which can cause Zika. And there are some places throughout the country that are showing that that mosquito is present.
Really?
And right now it's of concern for people who are traveling. We
To
have
other parts of the United States or outside the United States? Or
both. And it's more of a tropical location right now. But we are finding that mosquito most recently in Ontario and in Texas. But we are trapping throughout the state. Nashua wasn't a very good environment for those traps. They are more cumbersome, but that is something that is being done first time this year.
So the Environmental Health Department takes it very seriously, and so you're constantly reviewing and checking the atmosphere at a various points in order to determine if, in fact, there's an impact where there could be a virus affecting anybody?
We do it during mosquito season.
Okay, and mosquito season goes from when to when?
The season officially starts in July. We typically don't see any disease, any evidence of disease, not in humans, but in mosquito pools, until the beginning of August. And then it extends to that first hard frost, or typically the end of October.
So it begins in July, interesting enough.
Yes, and most people start to think about mosquitoes as soon as they start to see mosquitoes. And those are typically the nuisance mosquitoes at the beginning of the season. We really don't start to worry about any disease transmission other than traveling until July to August.
And when you find that there is a virus that has been contracted, how is it communicated to the Environmental Health Department? And how do you then inform the public as to this going on and what they need to do related to being more mindful? I know we're trying to do that now, but how does all throughout our country the health departments inform people?
Well, there are different methods of surveillance that are going on as well, and this is where you'll see there was just a press release that the state put out about Jamestown Canyon virus. That's important because practitioners, the medical staff, need to be aware and test the humans who are presenting with some of these
Symptoms.
symptoms.
What are the symptoms for that?
Well, and that would be pretty much the basic flu-like symptoms: malaise, tiredness, headache. and then along with the fever and either the meningitis or the encephalitis, which the hallmark for that is a stiff neck.
Okay, so if we're to summarize the most important information that you want people to know about related to this, what do they need to do?
Prevention. It's all about prevention.
And what do you want to let them know they need to do?
Be mindful of mosquitoes. Try to actually think about when you're going to be most likely to run into mosquitoes. Use whatever product you are comfortable using strictly according to the package labeling. Then you also want to look at your home, again, whether it's something that you rent or own, and take a look at screening materials, trying to keep the bugs out, and doors and windows, and not creating little environments where mosquitoes can breed on properties as well. Okay. Dumping out flower buckets and any little pool, any little container of water.
Okay, and use clothing as another defense.
Absolutely.
And light clothing.
Light clothing.
And long pants.
Yes.
Long sleeves.
Yes.
Hats.
Yeah.
Protects the head.
Yeah, and we're worried about sunscreens as well, so it doesn't help. I mean, it doesn't hurt to just have another barrier for sun protection.
Because if they can go somewhere else to get it quicker, they will, right?
Yes.
They'll pass you by. Now, if people wanted to learn more about this, the West Nile virus and EEE, is there a particular website they could go to learn more about it?
We have some basic information on our website, the Nashua NH.gov station.
Okay. And from a federal point all throughout the country?
CDC.
Okay, CDC.org.
.gov has really good information.
Okay.
And then New Hampshire DHHS has some information as well. CDC has the most general, broadest. It's a good starting point in its basic language. Mm-hmm. So it's a tremendous resource.
So symptoms people should be aware of so that they contact their physicians right away.
Flu-like symptoms.
Okay.
Fevers.
Stiff neck. And so if you have that, immediately call your primary care provider and be seen.
Absolutely.
Is there a telephone number that people can call for further information?
Our general department number is 603-589-3500.
Wonderful. We really appreciate your being here, and we thank you very much.
Thank you.
Until next time.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.